Good afternoon, dear friends. I welcome you all for this Facebook live program. I am Dr. Keshavamurthy V, Senior Interventional Cardiologist. I am practicing cardiology since last 15 years. I did my MD medicine from Mysore Medical College and worked in JSS Medical College as Assistant Professor in Department of Medicine. Later, I did my DNB cardiology training at Sri Sathya Sai Institute of Medical Sciences, Bangalore, and I have been awarded a gold medal in the DNB final exams. Since then, I am practicing in Mysore since last 15 years. I started this Department of Cardiology at Narayana Health Multispeciality Hospital in 2013. Since then, I am working in this hospital as the unit head. Friends, first of all, I wish you all World Heart Day 2019. I just want to say, what is this World Heart Day? Why do we all celebrate this World Heart Day? World Heart Day is the day to create awareness among the public all over the world to know how to prevent the heart diseases. Dear friends, all of you know that coronary artery disease are the #1 killer disease all across the world. Cardiovascular diseases, they contribute around 17.9 million deaths every year all over the world. It's the #1 killer disease, which is way ahead of all other diseases including the cancer. Such a dreaded disease. It is our duty as a medical professionals to create awareness across the world among all the public. So this year's theme is My Heart, Your Heart and Everyone's Heart. The meaning of this My Heart, Your Heart and Everyone's Heart is, my heart means as an individual I should lead a healthy lifestyle where I will have a minimal risk of heart diseases. So that to say that I should first be an example for others to lead a healthy heart lifestyle. And your heart, and as a responsibility, I should take care of the people around us, like our spouse, our parents, our kids, to lead them a healthy heart lifestyle. And everyone's heart, being a man in society, we need to see if we can able to establish some good practices that is going to keep a healthy heart for our society. This is about World Heart Day's theme. My heart means, according to the World Heart Federation, if somebody follows certain basic principles of living healthy lifestyle, we can prevent 80% of the heart diseases. For example, if somebody quit smoking, somebody practices healthy lifestyle, that is physically active lifestyle, somebody consumes healthy diet, the diet which is less fat, more in the vegetables and more in the fruits, and somebody refrain from the alcohol intake. If these simple 4 principles if somebody practices, one can prevent 80% of the heart attacks. Dear friends, heart attack is such a killer disease. I am seeing since last 15 years, day in day out, and plenty of patients coming with heart ailments. And nowadays, the most bothersome, most worrisome the trend is that very young people coming with the heart attacks. So when we are studying in our olden days, when we are student, we used to see heart attacks at 70 years, 80 years people, and we never seen a person in a second decade and third decade with the heart attacks. But nowadays, the people coming with second decade and third decade heart attacks become very common. After I started the department in Narayana Multispeciality Hospital, I might have done hundreds of people in the primary angioplasties at a fourth decade, third decade, and few in the second decade also. Such a dreaded disease is the heart attack. And this heart disease occurring in a young age It takes away the earning members from the family. They become less fruitful society, and if they don't treat them properly, they become burden to society. So it is our responsibility for every one of us to know how to prevent heart attack. And suppose if somebody develops heart attack, one should also know that how to take care of a heart attack patient, and where to take the treatment, how to take the treatment, what is the follow-up afterwards. Now I am going to briefly speak about heart attack, why heart attack occurs, and what are the things to be done to when the heart attack occurs. I am going to speak on that next part of my talk. Heart attack occurs because when there is sudden cessation of the blood supply to any part of the vessel due to the occlusion of the vessel, due to a plaque rupture, or due to the dissection of the artery, coronary artery. So that particular part of the heart suffers and get damaged. So if the blocked vessel is not opened up in right time, so that the muscle damage will become permanent, and patient will develop a weak heart throughout his life. So to prevent that, person needs to seek a medical attention at the earliest. A person with a heart attack, he has to raise alarm, and he has to consult a local doctor immediately. Once the ECG done, if the ECG shows there is a heart attack, the particular center, they give them first aid medication, and they refer to a centers where one can able to do the definite treatment for heart attack. Dear friends, I would like to say proudly to say that as a Narayana Multispeciality Hospital in Mysore, we are the only center who do primary angioplasties 24/7. So we do the primary angioplasties any time of the day, and we do at a timely fashion. So within 60 minutes of entry to the hospital, the angioplasty is done in majority of conditions, unless some other financial or some other issues. So once the patient reaches the Narayana hospital, we first give them first aid medications. Immediately we will take them to the cath lab. We will open the vessel mechanically by balloon, that is the primary angioplasty. Then we will put the stent to that culprit vessel so that the blood circulation is re-established, and the heart will bounce back to normal at a very shortest possible time. This is the primary angioplasty. So once the person gets primary angioplasty done, we will keep him in the hospital for 48 to 72 hours. Then we will discharge him with medications. So once we go back to once we discharge from the hospital, he will put on medications, and we will educate them how we can come back to a normal lifestyle. So majority of these people, once they go back after the 1 week, they can start doing their physical activities, and after 2 weeks they can resume all the activities what they are doing before, unless the heart is very badly damaged. This is how the heart attack patients we take care in our hospital. This is how they bounce back to normal as we care for the patient. As a person, what you should do to prevent heart attack is already told during the World Heart Day motto. The World Heart Day, the theme of the World Heart Day, as I told in the beginning. So if you follow few of them, one can able to prevent the heart attack. Up to 80% of the cardiovascular diseases can be prevented. One can have a long, healthy heart for us. So what are the things one can to prevent the coronary cardiovascular diseases? One is first and foremost is quit smoking. So smoking is very dangerous. So smoking majority of people develop the heart diseases. So smoking, whether it is active smoking or passive smoking, is not permitted, is not encouraged. So smoking should be strictly avoided. So as a person, apart from you quitting smoking, you should also see that our family members should not expose to the passive smoking. So we should take our kids, take our family, where the smoke free environment is there, so that the passive smoking is not encouraged. Apart from the smoking, then heart healthy diet to be practiced by ourselves and also at the family, and also in our community or meetings, wherever we are involved. See that the heart healthy diet has been followed. The heart healthy diet is the one where the diet contains very less fats, less saturated fats, and wherein less trans fatty, that is to avoid oil fried food wherein which increases the trans fatty acids. And then we should encourage the food with lot of fresh vegetables and fresh fruits. So a diet with fresh fruits, fresh vegetables, less oily food and more protein food. This is the food which is a heart healthy food. So this heart healthy food, where there are done trials to show that it itself can reduce the heart attack risk up to 20% of the patients. Apart from the heart healthy diet, and we need to adopt a heart healthy lifestyle practices. The heart healthy lifestyle practices is we should be active, we should go for regular walking, we should go for if possible we can participate in the physical activities, community activities like marathons or some cycling activities or hiking activities, all these physical activities which will keep our heart healthy. And also we should take our children and we should for the physical activities should play with our children regularly, so that they will also get heart healthy activities and will also get benefit out of that. And also will encourage the community where we live to participate in the heart healthy activities like marathons, walking, cycling, hiking, etc. This is the heart healthy lifestyle physical activities. And apart from that, we should refrain from alcohol. So alcohol is not good for health, is not good for the heart. One should refrain from the alcohol, whatever the form. Apart from that, one need to check ourselves regularly, periodically, to look for presence of diabetes, presence of hypertension, presence of high cholesterol. All this should be looked for because they are the silent disorders develops in the body. So one need to know our weight, one need to know our body mass index, and if we are overweight, we should try our best to reduce our weight and attain a normal body weight and attain a normal body mass index. And we need to go for the regular health checkups. If somebody is more than 40 years, definitely every year one need to go for health checkups, and whatever the age, at least once we should go for our regular health checkups to know our blood sugar levels, to know our cholesterol levels, to know our blood pressure levels. Suppose if your blood pressure levels are high, we need to take appropriate medical person's intervention and control the blood pressure to the normal. If the blood sugars are high, we need to go for the appropriate medications, appropriate diet counseling, and we have to control our blood sugar to normal. And if the thyroid problem is there, we need to check the thyroid and take it appropriately. If you do all these things, sugar, cholesterol and hypertension, and if you maintain the ideal body weight, so 80% of the cardiovascular disease can be definitely prevented. Such a simple thing. If everyone follows this simple advice, I think 80% of heart attacks can be prevented. We can live long with a healthy hearts. So this message has to be passed across our friends, our relatives, our well-wishers, so that we need to build a healthy society and in turn a healthy nation. Jai Hind. Thank you.